Hello, my name is Dr. Anamika Joshi. I'm an eye plastic surgeon, that is, I'm an oculoplasty specialist. I practice in Hyderabad, and today we are going to be talking about an important topic, that is, how successful is lower eyelid blepharoplasty surgery. Now, lower eyelid blepharoplasty is a surgery that is done for under eye bags or puffy eyes, which can make the entire face look very tired. Blepharoplasty surgery greatly improves the puffiness under eyes and gives a very natural lid cheek contour, giving a very refreshed and rejuvenated appearance. So let's understand in detail how successful it is. Overall, I can say that it's a very good surgery with very effective results, but let's break it down further. So, first thing that you need to understand is every eye bag or every under eye bag is different. Now, when the under eye bag is because of under eye fat prolapse, that means the normal fat that is present inside gets prolapsed out, then it appears as puffy eyes. Now, this type of eye bag is the most suitable for blepharoplasty surgery and gives the best results. However, if somebody has fluid bags or festoons or malar mounts, we call it, that means some fluid component instead of fat component, then blepharoplasty surgery may not give a very successful outcome in those patients. Now, most of the patients in our practice that we see are usually fat bags and therefore are suitable for blepharoplasty surgery. So that is the first thing you need to understand, whether your eye bags are due to fat, due to fluid, and you need to get that checked by your doctor. If you look up, you'll see if they are increasing, then they are most likely to be fat bags, and when you look down, they'll reduce. So if that is happening, they are probably fat bags. Now, secondly, if you have fat bags and you're thinking about blepharoplasty surgery, how does the success rate change? What are the factors? Now, if you have fat bags, then the success rate will determine on the technique that has been chosen for you. For every patient, we need to customize the technique that we'll be using for blepharoplasty, and the success rate will be dependent on that. If somebody just has mild fat bags and there is absolutely no hollowness, then only removing the fat can give very good results. However, if there is a little bit of hollowness under your fat bags, then just removing fat can actually increase the hollowness, can increase the wrinkles, and may not give the best results. So what do we do in case if there is some hollowness under the fat bags? Then it's better to do preservational blepharoplasty or transpositional blepharoplasty, we call it. That means instead of removing this fat, we transpose this fat down onto the hollowness of the cheek such that it gives a nice lid cheek junction with a plain natural contour with no increased wrinkles or no increased hollowness. If somebody has more hollowness, then you may even want to add a little bit of fat from the abdomen or thigh. That means you may want to do a little bit of fat grafting also for best results. So this is important to understand that in case if there is hollowness, then just removing fat may not give you very good results. So it's important that you discuss these things with your surgeon. In my practice, most of the patients, I would say 90% of the patients require either fat transposition or fat grafting, and usually 90% patients will have some hollowness. So I usually prefer transposition technique for even better success results or enhanced results, right? Now, your blepharoplasty results can also be enhanced by taking care of other things along with the fat bags. That is, if there is any loose extra skin, that also needs to be removed for a good result. If there is any sagginess of the cheek, then you may need to add a little bit of mid-face lift to give a better result, and such small maneuvers can enhance the effect of your blepharoplasty surgery. Once your blepharoplasty surgery is done, it's important to also check the condition of your under eye skin. Skin is a very important determinant which will greatly enhance your blepharoplasty result. So usually some form of chemical peeling or some form of lasers can tighten the under eye skin and can enhance your blepharoplasty result based on what you need. Every patient is not the same. Some people may need it, some people may not need it. It also depends on the skin type, the color of the skin, whether what can be done and what may not be done. So all these factors are important in determining how successful will your lower eyelid blepharoplasty surgery results look. Overall, I can say that it's a very good surgery and gives very good results. Just it's important to choose a surgeon who understands the anatomy of the eye region, who understands your needs very well. And I'm sure that once it is done correctly, it gives very good results, right? I keep posting about blepharoplasty surgery and related information on my Instagram profile. If you have any questions, you free to ask us, and I hope this helps.